Hey everyone, and welcome to the Gaining Health podcast, where we are revolutionizing healthcare with obesity medicine. I am your host, Karli Burridge, and I am beyond honored and delighted to have Miss Sandra Christensen as our guest today. So Sandra Christensen, who many of us know as Sam, she is a family nurse practitioner who's been specializing in obesity medicine since 2005. And in 2009, she founded Integrative Medical Weight Management with the goal of providing comprehensive evidence-based treatment in a healing, inspiring setting. I love that. She's been an active member of the Obesity Medicine Association since 2005 and currently serves as a trustee on the board of OMA. She was named a fellow of the OMA in 2016 for her dedication and commitment to the clinical treatment of obesity and obesity-related diseases. And she was the recipient of the Dr. Raymond E. Dietz Meritorious Service Award in 2018 and the recipient of the Committee Leadership Award for her role in creating the Obesity Medicine Association Speakers Bureau in 2019. She's also a founding member of the Washington Obesity Society. And she is a wonderful speaker and presenter, and she speaks frequently at the Obesity Medicine Association, at the American Association of Nurse Practitioners, at the American Academy of Physician Assistants, and many other health organizations. She is also an author. She's amazing. So in addition to writing and publishing a book, which is called A Clinician's Guide to Discussing Obesity with Patients, which was published in 2021 by Springer. She's also authored several professional articles, including peer-reviewed articles, including several of the clinical practice statements in the Obesity Pillars Journal, and she is a contributing author of the Obesity Medicine Association Obesity Algorithm. And last but not least, she has served as a mentor to numerous clinicians who are new to the field of obesity medicine. And that's actually how I first got to know Sam, was at my very first Obesity Medicine Association conference. She was my mentor, and I was just so fortunate to have her as a mentor, as so many other people have been. And ever since then, we've just had this close connection, and she's such an inspiration and a mentor to me. So, and a dear friend. So Sam, I'm just so excited to have you here. Thank you so much for coming on today.
You are so welcome. It is my great honor to be with you today. And I'm so delighted that you are starting this podcast, because everybody needs to hear from you, Karli. And you are such a rock star. And I'm so excited about all the possibilities that this podcast will bring for you and mostly for your listeners, and really spreading the word about obesity medicine. And I also want to say that you're living proof of the value of mentoring, right? The value is that you help somebody along, and then you just stand back and watch them shine and watch them go. And that's probably the biggest thrill that I have in that realm.
Well, you play such an important role in that, because especially when we're new to something, it is so helpful when we have somebody there to support us, to guide us through it, to give us the confidence to do things that we're not sure we're ready for yet. And so you have just played such an instrumental role for me, and I know so many others, in being that support system. So I'm so grateful to you. So I know you just got back from a very exciting women's health conference that I know we had talked about before, that you were really looking forward to. So Sam, can you tell me about it? How was it? I want to know all about it.
It was fantastic. It was called the Women's Cardiometabolic Health and Wellness Masterclass, and it was sponsored by the Congress of Cardiometabolic, or the Cardiometabolic Health Congress. And it was their first event, and they're planning to have more, which I'm so excited about. I went there because I really wanted to understand the cardiometabolic complications and issues that my female or my women patients with obesity have. And I learned so much more about conditions like heart failure. There's a big movement to actually rename heart failure to heart function and kind of place people on a spectrum. I learned about more about PCOS. I learned about ethnic and racial disparities, as well as racial and ethnic disparities in obesity. We did have one fantastic speaker, Fatima Cody Stanford, who talked on that. Learned about aortic stenosis, the latest in lipid management, and it was really broadened my perspective about the ways that we can really impact the health of our patients with obesity, and particular women. And the conference itself had this sort of pioneering spirit, like we experience when we go to our OMA conferences. It was organized and run by some female cardiologists who are a minority in their specialty. And it was filled with med students and residents and fellows, all female cardiologists in that realm. And it was really thrilling to just feel their energy and be inspired by them, and to see them inspiring one another and all of us. So that was really exciting.
Sounds like an amazing conference to go to. Sounds incredible. And I know you're really passionate about women and obesity and their cardiometabolic health. What is it? Why do you think that that's so important that we really address some of the things that women in particular struggle with when it comes to obesity?
Well, women are disproportionately affected by obesity, and then women of color and low socioeconomic groups are even more so. And, I think a fact that's true about obesity is one that I learned in the conference, which is how underrepresented women are in studies. And so when these very expert presenters who were at the top of their field were sharing information, they said, we don't really exactly know how all these agents work in a female body, excuse me, a woman's body. I'm going to take a sip here, sorry. They said, we don't really know how all these agents fully work in a woman's body because they're so underrepresented in the studies. And so that was very helpful to know, sad as it is. And we learned some strategies of how we could get more women enrolled. But what's tragic to me is that, in particular, women who have cardiovascular disease, is that it isn't recognized by clinicians as readily as it is in men. And so I know that I have frustrations at times as a specialist, obesity specialist, and I refer my patient to a cardiologist or someone for evaluation or their primary care, and they really don't get the thorough evaluation that I think that they need. And so sometimes I'm watching a condition worsen and nobody's really doing anything about it. So the value of going is that I have a better understanding of the therapies out there, and I can refer people to those who offer those therapies, and to providers that really understand the effects of obesity on a woman's cardiometabolic health.
Awesome. That's so important. So great. And I love that this is a field that you're passionate about within obesity medicine, is really, women in obesity medicine. But I want to backtrack a little bit too. And I wanted to talk to you about what got you first started in obesity medicine, because for so many people, they never even heard of obesity medicine. They don't know what it is. I know everybody has their own journey, and those of us who have found obesity medicine to getting to that point. So can you tell us a little bit about how and why you first got started in obesity medicine in the first place?
Yeah. Often when I tell my story, I tell it from when I first encountered obesity medicine, but really it goes back further than that. When I was 30 years old, I was diagnosed with a rare cancer, and I received treatment that was very successful. But it made me realize how precious my health was. And so I really went out in pursuit of a healthy lifestyle. And I learned everything I could about nutrition and physical activity and sleep and stress reduction back then, because I thought, I want my cells to have everything they need to be healthy cells and not to become cancerous. And so I had a strong interest in that. And that actually spurred me on to go back to school and become a nurse practitioner, because I had been a stay-at-home mother with my 3 kids. And so I did that with the goal of improving the health of my patients. And so I became a family nurse practitioner, and I worked in women's health because I love women and I love women's health. And I had worked in reproductive health, obstetrics, gynecology. And my patients would come to me and they would want me to help them with their weight. And I could tell them some of the things I knew, but I realized I didn't know anything about how to really effectively help them to reduce their weight. And so at a certain point, I became a little burnt out in what I was doing. And I saw an ad in a nurse practitioner state organization website that had, jobs available. And I saw it on there. And when I read it, I just instantly knew I'd found my thing. It's like, oh my gosh, this is exactly what I want to do. And so I was fortunate enough to start at a hospital-based clinic with a physician mentor who taught me how to be a mentor, who was a real leader in the field of obesity medicine, and another nurse practitioner. And so they just taught me like on the job. I learned the pathophysiology, I learned the assessment, I learned the pillars of treatment right there. And so I've loved it ever since.
It's amazing. I think so many of us have that moment, like that one moment where we're introduced to the field or where we hear about it for the first time and just something just clicks. It's like this light bulb moment of like, hallelujah, yes, this is what I've been looking for. And I didn't even know that this existed. And and I know that we've talked about also organizations like the Obesity Medicine Association, where, I know for myself, that's where I learned most of what I know about obesity medicine was through them. And just, the first time I heard about this organization and the first conference I went to, it was just like, yes, this is it. And so it's funny that, you have those specific moments when you saw that ad, you're like, yes, this is it. And it's also interesting that even though you went through all your training to become a nurse practitioner and you had done all the research yourself already on nutrition and physical activity and stress, and despite all of that, you still felt like you had no idea how to help your patients who were struggling with weight. And I just think that, speaks so much to the fact that, obesity is a disease, and treating obesity is more than just understanding some of the lifestyle changes and what works for you. It's really about understanding the pathophysiology and understanding the hormones, and that every person is different. So so aside from learning on the job, where else did you go to? Where else did you turn to get some of that education for you to feel comfortable, treating patients and treating patients successfully for their obesity?
Yeah. Well, again, I was just so fortunate because, as I said, my physician mentor was a leader in what was called the American Society of Bariatric Physicians at the time, that is now the Obesity Medicine Association. And when I left the interview where he said he wanted to hire me, this was back in 2005, he handed me a big case full of CDs that were the board review course for physicians who were going to sit for the obesity boards. And he said, I want you to listen to these before you come on your first day in 2 weeks. And so I did. I listened to them, and, it was so amazing. I didn't know anything about the pathophysiology. I was learning about appetite and weight regulation, all the hormones that are involved. I was learning about how to adequately assess patients, all the, nutrition, physical activity, behavioral counseling, pharmacotherapy, everything right there. So by the time I walked in that first day, I had gotten such an education. And that was just, of course, the beginning of it. I did listen to those over and over and over again. Once I had a little clinical experience, I needed to go back, and it made more sense to me then.
Yeah, absolutely. And so tell me about your transition then in 2009. So you started out in this clinic and you had an amazing mentor. And at some point you decided you were going to go out on your own. Can you tell us a little bit what that experience was like? Because I know there's a lot of providers out there who are perhaps thinking about doing that, starting their own clinic. It takes a lot of courage to do that. So can you tell me a little bit about what that process was like for you, and how was it when you started your own clinic, and how is it for you now?
Yeah. Well, that was a really pivotal moment in my life for sure. And my physician mentor had retired, and our non-surgical clinic had been suddenly merged with the surgical clinic at the hospital, and it was just sort of thrown into it. And at the time, the lap band surgery was really popular, and the surgeon really wanted me to learn how to fill lap bands and spend the majority of my time filling lap bands. And I just did not want to do that. Was highly skilled, highly educated at that point, and I thought, this is not how I can help people. I understand obesity. I want to help people. And I had never dreamed in a million years that I would ever own my own practice. I always thought I would be an employee. And within, I would say, like a month or two of that, I was like, no, not doing it. And so I started to contact other hospitals in the area and say, would you like me to, start a program for you? I know how to do this, because I'd not only learned how to treat patients with obesity, I'd learned how to be an entrepreneur because of the type of clinic that we had. And none of them really bit. And I thought, well, maybe I'll just start my own. And within 3 months, I was open. I just once I knew, I just made it happen. And since I had a really solid understanding of how to treat obesity, I already had treatment protocol. I already had an understanding of how to structure the treatment, the appointments, et cetera. So I found myself a space, and I, bought all my furniture that can, what we call bariatric furniture that can, safely and comfortably accommodate people up to about 650 pounds. I made the office beautiful with plants and art, and painted the walls, and got started. And I can recall very vividly on that very first day that I was sitting at my computer between patients, and I needed to do something. And I thought, oh, I guess I don't know if I can do that or not. And then I went, oh, and I looked over both shoulders, and I went, nobody's looking over my shoulder. I can do whatever I want here. And that was just such a liberating moment. And I'm so thrilled that I have my own practice, and that I can spend my time and energy helping my patients and not navigating bureaucracy. And I can really just put my focus there, and they really feel it. They really feel that experience when they come in, that it's beautiful and they feel welcome. And one patient came in yesterday and said, this feels like home. And I was just like, oh, that's what I want you to feel.
Yeah, it's so
Yeah.
important, that part of it. I think people often forget how important that is, how your patient feels when they come into your office, when they leave your office. So important. And I know your office is just beautiful, and I love that you were able to design it exactly how you wanted it to be, and that's one of the benefits, right, of being your own boss. You can make it exactly how you want it. So can you walk us through a little bit, what your day to day looks like as somebody who owns their own practice, who's seeing patients? What does your day to day look like? What does your kind of your time structure look like? What types of things are you doing with patients when they come and see you in your clinic? Can you describe that a little bit for us?
I can. So what I have that many don't, that's most valuable, is time. I have lots of time with my patients. So I can do like a 1 hour consultation when they first come in. I get their history and get a better understanding of their health and their past experiences with trying to reduce their weight and their lifestyle. I get a really good picture of them. And then they will come in 2 more times for an hour each. So, typically 3, 4 weeks in a row, I see somebody weekly, and the first 3 are 1 hour appointments. So a typical follow-up appointment is, I have it in a 30-minute slot. It's supposed to be 25 minutes, but it's 30 minutes usually. Um, And so once I have done the history and the physical and reviewed the labs and given them an eating plan and an exercise prescription, then we're just following up on how things are going. And I'm modifying, the treatment plan, introducing anti-obesity medications, changing other medications if they're on things that cause weight gain. And then I'm just meeting them where they are and what do they need this week. And there's so many thrilling moments. I had one earlier this week of a patient I've worked with for a couple of years who came into me with just the most terrible osteoarthritis in both her knees, and she needed knee replacements, and the ortho surgeon wouldn't do them because of her weight. And so she worked really, really, really hard and just did everything possible, got it down to a certain point, still wasn't at the BMI category they wanted. But I advocated with the ortho surgeon and said, this is what's holding her back. And she had one knee replaced in the spring. She got the second one done in the summer, and she walked in with those fantastic new knees. And even though she's just a month post-op from the last one, she was walking better than I've ever seen her walk. And that's just like one of those thrilling, thrilling moments where you realize you're really making a difference.
Yeah. Yeah. I mean, you're not just helping her with, with her weight and her nutrition and her exercise. You're a real advocate for her. And that's amazing. And I know your patients must appreciate that so, so much. So switching gears a little bit. So I know the way that you communicate with your patients, I think is very special. You're a very good communicator. And you wrote a book about, how to discuss obesity with your patients. So can you tell us a little bit about what inspired you to write this book, and what do you think are some of the bigger takeaways that our listeners can hear, especially for people who perhaps aren't in obesity medicine yet, or they don't quite know how to have that conversation? I think it's often a big barrier for people is they don't know how to bring it up with patients. They don't want to offend their patients in any way. So can you tell us a little bit about what inspired you to write the book and some tips that people can take home and use on Monday morning as they see their patients?
Yeah, yeah. So, like many things, it came through my patients, through the stories that my patients told me about encounters they had with their primary care, or like this orthopedic surgeon, where either nobody had ever talked to them about their weight and it had just gotten worse and worse and worse, or they did talk to their patient about their weight in a way that was hurtful to the patient. And sometimes it was pretty obvious that that person had some very explicit bias against people with obesity. But most of the time, it seemed more like just this lack of knowledge, just don't know how to bring it up. And so I thought, you can't treat somebody for obesity if they don't get referred to someone who knows how to do it, right? And you can't do that if you haven't talked about it. And we talk about all these other conditions that people come in with. If someone comes in with a high A1C, the provider is going to talk to them about diabetes, right? Or if their lipids are high, they're going to, diagnose them and treat them. And so I realized that even though I have a lot to share about how we treat patients with obesity, that we needed to take a step back to have the discussions that can lead to the treatment. And so in my book, I start by educating the reader that obesity is a disease and give them an outline of how we treat it. And then I help them understand weight bias, both explicit and implicit, and give them strategies so that they can recognize in themselves and in their staff and then reduce it. And then we move on to the nitty gritty of how to do this. Here's the barriers, here's ways to overcome them, with demonstrations of sample conversations of encounters that have gone well and ones that have not, and then tips on how to do it well.
Awesome. Great. I think this is such a valuable resource because again, I would say that's one of the biggest barriers is not knowing how to have that discussion. And also how that discussion goes is such a huge factor in how the patient feels, their own internalized weight bias and stigma and the success that they'll have. Because if they feel stigmatized, if they feel judged, if they don't feel free and open to discuss these things without judgment, you're not going to get anywhere, right?
They're not. No. Yeah.
Yeah,
And
absolutely.
in terms of internalized weight bias, that is something we revisit again and again with patients. No matter how much I help them to, let go of that blame and shame that they're doing to themselves inside, it seems to, pop back up, and we have to review it again and again. And all of us have bias, right? And so we as clinicians also have to always be looking at that. And what are the ways that I'm, maybe explicitly or implicitly communicating bias and maybe stigmatizing my patient or anyone else that has obesity?
Yeah. And so I know we talk a lot about language being very important. So do you have some tips on, certain words or language that clinicians can use with their patients when discussing weight and perhaps also some that we should try to avoid?
Yeah. So, what's first and foremost is that we use people first language for obesity. And that means that we put the person before the disease. So, we would want to use the same type of people first language that's used for people with diabetes, with depression, with autism. We, instead of saying obese or morbidly obese, which are labels and are very derogatory, we want to refer to someone as a person with obesity or a person affected by obesity. And that can make a huge difference. It was a thing I noticed at the conference that I was at last weekend, is that that particular group of clinicians hadn't been educated on it. That is until Dr. Cody Stanford came along and taught everyone about people first language. So that was really good to hear and to see. So, so the other thing is that it can really help a discussion if we ask permission to talk about obesity. So asking a patient, do I have your permission to discuss your weight, or would you be comfortable? Not would you be comfortable, but um, would it be all right if we talk about your weight as it relates to your health? Questions like that. Because what we often do is we just kind of launch in, like, okay, we got to address this. And we do that with other conditions without asking permission. But many of those don't have the same level of stigmatization that obesity does. And and some clinicians balk at that suggestion that we ask permission, but I think it's a really respectful thing to do. And it's something that I notice happens in lots of other arenas, when I'm maybe going to get a pedicure or manicure or something, would it be all right if I touch here, like when I get my glasses adjusted, they ask that. And so I think it's really a sign of respect when we do that. And honestly, I hope we get to a point where it's just such a normal part of an encounter for someone with obesity, and that they're having good experiences with their clinicians, that we maybe don't have to ask anymore, like we don't
Right.
for the other things.
Yeah. Once that weight bias and stigma is no longer there and it simply becomes a medical condition, which it is, just like diabetes or hypertension, once we get to that point, then we may not have to ask for permission to discuss weight. But until we get to that point, I think you're absolutely right because there is so much bias and stigma, and many patients may have had very negative experiences with healthcare providers and just that weight bias and stigma is everywhere, all around us, all the time. And so, I think I agree with you. It's important to ask permission, and hopefully, we get to the point where obesity truly is treated and viewed just like other chronic medical conditions. But unfortunately, we're not there yet, and that's one of the reasons for having this podcast is to get that information out there about why obesity is a chronic medical condition, just like so many others, and that it deserves the same amount of evidence-based treatment and compassion too, right? I think that is so important as well.
It is. And that's why I'm so excited you're doing your podcast because it's so needed. And, just at the conference that I was at, when people heard that I was an obesity specialist, they would approach me. They wanted to talk to me because that's exciting to them. And that was quite a difference than it was back in 2005 when people would just kind of just tilt their head and go, "Oh, that's nice that you do that," and then change the topic, and now they're like want to learn. But several of the clinicians would talk to me about food addiction, like how do you treat the food addiction? Like that was the cause of obesity. And so I had a chance to educate them a little bit, but I think that's a really common belief, that it's all about eating and that they must be addicted to food, and so there's lots of education needed, and I'm just thrilled that you'll be the one delivering it.
Yes, well, I am so excited. And so, to wrap up this conversation with you, what are some things that you're really excited about for your professional career, for the field of obesity medicine in general?
Well, I'm excited by all the new pharmacotherapy options that are in the pipeline, some of which we have in our hands. And, if you look at the list of what's in development, it's very thrilling. There's lots of great agents, and we're getting to a point where some of these agents are going to have an equivalent effect to bariatric surgery. And so that's a really exciting thing. We're still really, really struggling with insurance coverage for these meds. I do see progress being made. So I'm really hopeful that that will follow with all these really effective agents because, I learned a lot about a lot of cardiac meds at the conference. I'm sure they're very expensive too. And I imagine that they'd be more likely to be covered on insurance than an anti-obesity medication. So that's where we have a lot of work to do. But I also think we're moving in that direction. And what I'm most excited about right now in my career and in my professional development is really diving more into what the experience is for women with obesity. I want to understand more about all the things in their lives that contribute to the obesity, that make it worse, that make it harder to treat. I want to understand more about how it manifests in their body, like the cardiometabolic health conditions. I really want to understand that better and both study it and present on that topic. So I'm really excited about that. I'm also really excited about um, mentoring speakers so that we have more voices out there to teach people about how to treat obesity. So I really am trying to work with as many people as are interested to teach them that their voice matters and they have a lot to share and that their colleagues really need to hear from them. So those are the things that are lighting me up at this very moment.
Awesome. Well, thank you so much. And hopefully you'll come back and talk on the podcast some more another time specifically about women and obesity, because I know you have so much to share. There's still so much to learn, but you have such a wealth of information already. And so would love to have you back again. And until then, can you share with us how people might be able to follow you or where they can find you?
So I'm on LinkedIn. Just look up Sandra Christensen. My practice website is Integrative Medical Weight Management, and you can reach me there as well. I'm not very good about being on social media. I do respond to any requests that come through LinkedIn, but those are ways that people can connect with me. And then, of course, you'll always see me at an Obesity Medicine Association conference.
Awesome. Well, I can't wait to see you in Anaheim soon this fall in person. And thank you so much for being with us here today. Thank you, Sam.
Thank you for having me, Karli.
Thank you so much for joining us on the Gaining Health podcast. Don't forget to review and subscribe. And if you really liked it, consider supporting us on Patreon. Lastly, if you need resources and tools to help you start an obesity management program, be sure to check out gaininghealth.com. Thank you, and we'll see you next time on the Gaining Health Podcast.